views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗏𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗏𝗏𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗏𝗏𝗏𝗏 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗏𝗏𝗏, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗏𝗏𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗏𝗏𝗏. I'm your host, Nicole Jacinto. Today, we're going to discuss vaccines and vaccine-preventable diseases. Our guest today is Dr. 𝗏𝗏𝗏𝗏𝗏𝗏. He is an internist and he practices at the Health Hub of Makati Medical City. How are you today, doctor? Hi, Dr. Tim, is it? Yeah, that happens to me a lot. I'm the host, yes. How are you today, doctor?
Very good, very good. Just had my cup of coffee and I'm ready to go.
Yeah, okay, great. Yes, I have a cup of caffeine here as well and some sugar. I think I need to be an antiemetic. Yes. Okay, so anyway, before we start, I'd like to say hello to Winnie Ching, who sent a message. Winnie, thank you for watching, and I gather you're watching live because you just sent this message. Magandang hapon sa inyong lahat. Kayo dyan sa inyong lahat at kaibigan ko si Ate Nicole na Healthline with 𝗏𝗏𝗏𝗏𝗏𝗏. Salamat din, Winnie. We've never met, pero thank you for tuning in and thank you for watching all the time and sending us your messages, knowing that you're out there listening to us and supporting the show. Hopefully, you get enough information from the doctors who practice at the prestigious Makati Medical Center. Okay, so do I call you Dr. Cruz, no? Dr. Timmons Cruz? Or Dr. Tim?
Doc Tim na lang.
Doc Tim na lang. O sige, Doc Tim. Okay, so today we're talking about vaccine-preventable diseases. I know it's like a large, there's a large array, but can you give us some of maybe the most common and maybe some of the most unusual also vaccine-preventable diseases? Can you tell us what they are? What are the vaccine-preventable diseases?
Yeah. So some of the more infamous diseases that are vaccine-preventable include your polio.
Mm-hmm.
No, you have your measles. We call it here in the Philippines tigdas.
Okay.
And then mumps or beke.
Mm-hmm.
And then you also have your rubella, tigdas hangin. Together, they are protected with the giving of MMR vaccine. That's why it's measles, mumps, and rubella.
Okay.
So other vaccine-preventable diseases that are very that we hear often include your tetanus, your kilagatin tetano, and then your chickenpox or bulutong.
Okay.
No, we also have vaccines for hepatitis A and B, and then for the children we have vaccines for the rotavirus, which is a common cause of diarrhea. Mm-hmm. Typhoid, and of course, we also have vaccines for rabies. So that's one of the more common diseases that we can prevent with vaccination. Mm-hmm. And of course, we have COVID-19.
Yes, COVID-19. Thank you, doctor. Okay, doctor. Okay, so I'm going to ask you a couple of questions based on what you said. When it comes to the polio vaccine, can you just a lot of kids, since they've been vaccinated already with the polio vaccine, they don't kind of even know
yes
polio is. Can you just like a brief overview and like how it was so important before to get a vaccine and get vaccinated for polio, for example?
like actually polio being not known is actually a success in vaccination. So now that we don't see any patients with polio, it's just shows that the government has done a good job in
Mhm.
promoting their polio vaccination. Actually, we have the target for our country is targeting to have zero polio by the year 2025. So we're already reaching that. We have very few reports of polio, and this was through the efforts of the oral polio vaccination done, which started during the expanded program for immunization. So
Okay.
polio essentially is a virus
Mhm.
that affects the nerves.
Mhm.
One of the more common manifestations of having polio is inflammation of the spinal cord, leading to paralysis of the lower extremities.
Okay.
And then
And-
in worst cases, it would be paralysis of the whole body.
all right. Does polio affect any other body part?
Yeah,
Just
well, polio initially affects the spinal cord, but it can affect the whole nervous system. So
oh,
yeah.
okay. Thank you, doctor. And then when it comes to measles, no, how about the German measles? Is there a vaccine for that also? Di ba
Yes.
that German measles?
The German measles has lots of names. So you have it's called measles is just the measles, but
Yeah,
German measles is what they call as the 3-day measles. Here we call it tigdashangin.
tigdas hangin.
No. It's called tigdashangin because it usually lasts only for 3 days and it goes away.
Okay.
So it's actually part of the MMR vaccine, which stands for measles, mumps, and rubella.
Okay. So once you get vaccinated with the MMR, that covers the German measles also.
Yes.
Okay. All right. And then when it comes to, because I remember when I was a kid I had like some relatives who got the German measles, and they were like, okay, go get it now. When I was growing up, it's like if somebody got something, go get it now. Put all the kids together so they get it now, so they get over it. That was kind of the practice when they're young. So they develop the antibodies. So we'll talk about antibodies and antigens later, of course, when you discuss like how vaccinations work. And then for rubella, what exactly does it vaccinate against? Is it like, sorry, go ahead.
Yeah.
Yeah.
Rubella is really just a different. It's a different virus, but it usually manifests with non-specific symptoms. Usually a rash, fever, and then it could manifest in some of the patients who are not vaccinated. It could progress to central nervous system defects as well as pneumonia. So, rubella, measles, and mumps are usually they actually look the same. They have very similar, at least for the initial manifestations. They look very similar, and it's quite easy to brush it over. I mean, some kids would just have rashes and then fever, and then the next day wala na. So it
Yeah.
does happen. So, but then the beauty of vaccination is that we don't have there's a very small chance that if you have the rash, the fever, you could develop into something much more severe. And then the beauty of vaccination is we don't let it happen. We don't let it happen to that point. So we
Yeah.
stop it before you even get it.
Okay, great, great. And then you did mention there's a vaccine for chickenpox. Was there always one? Because
Yes.
there was always a vaccine for chickenpox. Okay, because again, I may be showing my age here, but when we were growing up, it was like I mean, parang we didn't, and we had like of course our pediatricians, but we didn't. It seemed like a lot of us didn't get vaccinated for the chickenpox, and I won't say what year that was, decade, but like again, oh, they have chicken pox. Shh. Everybody stay together, get it already when you're younger and all of that, because it's
Yes.
it's more difficult to get it when you're older. So there always has been, apparently. Is it the gamma globulin? Is that it?
The gamma globulin is more of a different type of vaccine. It's a passive vaccine. But what we have for the chickenpox is what we call as the varicella vaccine.
the varicella? Okay,
So
yeah.
right now, there are actually formulations that is actually called MMRV. So that's measles, mumps, rubella, and varicella.
And
So
right.
that's the one that we're already giving now. I
Okay.
also remember a time that I myself actually had the chickenpox.
Yes.
So when I did have the chickenpox, then it was more of you just stay at home, more of hindi na ako pinayagang pumasok kasi baka lang makalat ko pa sa iba, no. Pero
Yes.
yeah, for my family, sama-sama na kami ganun.
Yeah.
Parang ganun naman. And then it's true that when you do get your varicella or your chickenpox at a later age, the only thing that's concerning is that there is scarring.
Mhm.
So when you're a kid, yeah, I mean you just grow out of all the chickenpox scars. But then when you're older, syempre, you retain your
Yeah.
some of your scars, and that's the one that is parang what we're trying to avoid.
Yeah. I do have a pox mark somewhere here. I'm
Yeah,
sure it's still there.
it
Kasi
fades.
kahit when I was a bit older, and it's really like I'm sure a lot of people do remember that, like isama-sama mo na, and boy,
Yeah.
that chicken pox was really like, ay nako, you had fever, you had this, your whole body felt horrible,
Itchy.
and then itching everywhere, and then you're
Yeah.
like, you have a bunch of kids, or well, we were older then, but like, running to the bathroom in the middle of the night just to take a shower, anything to get the itch out. So, and anyway, there may be people watching who have memories like that
Yes,
of these things.
definitely.
But I'm glad to hear that nowadays you can already put that in, and in terms of the chicken pox, and also, okay, so you do have a vaccine. There's a vaccine against typhoid. How often
Yes.
do people receive the vaccine against typhoid?
It's actually part of the expanded program for immunization for our children. So it's still part of the usual
Okay.
vaccinations that we do get, even from not even from the government, the health barangay health centers. So down to the barangay health centers, we have that. We have that.
Yeah.
So we do get that.
Okay, that's good. I think maybe before we didn't really have it up to that extent, no, all of these vaccines. So yeah, I got typhoid. It's horrible. Feels like your bones are burning.
Yes.
And then also, okay, HEPA A and HEPA B. A lot of people, including myself, would be hesitant to get this because of the coming back, the part where it
Yeah.
comes back. But can you tell us how rampant it is in the country, and maybe why it's a good idea to get HEPA A and HEPA V vaccine? Like how do you contract it, and how easily can you contract it, and why do you recommend it?
Okay. So starting off with hepatitis A, ito yung the usual butt of jokes is that HEPA A is when you eat your street foods.
Yes.
So that's kind of true because hepatitis A is transmitted through the oral route.
Mm-hmm.
So if the food is soiled and it has hepatitis A, you can get it. So
Okay.
in part, that's true. That's how hepatitis A is acquired. However, hepatitis B is more prevalent compared to hepatitis A. No, hepatitis B, however, also attacks the liver. It's a different virus. It's a same group of viruses, but very different families.
Mhm.
Now, the hepatitis B virus can be transmitted through sexual contact,
Mhm.
and through the most common form of transmitting it is from mother to child.
Okay. So
So
if
actually, that's the target of our immunization at the moment, mother to child transmission, because that's still the most common.
Mhm. So when you say mother to child, do you mean when the mother gives birth? Is it through the
Yes.
birth canal, or okay? What if
Yes,
it's a
through
cesarean?
the birth, when the patient when the baby goes through the birth canal, because again it's a blood, it's transmitted through the blood. So when the baby goes out of the womb and covered in blood, the baby can get the hepatitis B.
Okay.
Now, it's
What if it's
important to prevent hepatitis B because it's one of those viruses that is causally linked to cancer. So hepatic cancer, liver cancer. So
Okay.
the younger you get it, the earlier you get it, quote unquote, during at birth. By the time you grow at around 30 years old, you already have signs of liver cancer.
Okay.
So
Okay.
that's why it's a very big trust for us to get the vaccination for the hepatitis.
And we'd like to raise this awareness, no, even more.
Yes.
That is very important because it can, if you don't get it when you're a kid and somehow you get it, it's transmitted to you. By the time you're 30, you can already show signs of liver cancer or hepatitis.
Yes.
Okay.
So that's actually the main problem with hepatitis B. It's that it's one of those linked to actual cancer. Now, if you do get it at a later age, at a later time, hepatitis B,
Mhm.
and the other form that you would get is through blood transfusion from a hepatitis B patient, which is very, very rare. And next is as a sexually transmitted infection. So
Okay.
if your partner is hepatitis B positive, you can get it. But then, syempre, we don't want to get it. But then, the risk of cancer is somehow diminished. But
Okay.
that doesn't preclude. Doesn't mean we shouldn't get the hepatitis B vaccine.
Yeah.
Still, we should. We want to prevent hepatitis B vaccine.
Yeah,
Hepatitis B through
yes.
vaccination.
Yes. You wouldn't want to get sick. That's the point because the illness can damage you more than well, first of all, it's an illness, it's a disease, and it can damage you more than you'd expect.
Yes.
And you still don't want to get it. So if you say, okay, yes. So I'm glad you clarified that, no, that the younger you are when you get it, you found a link between hepatitis B and liver cancer. The older you are, it's less likely that you'll get liver cancer, but still you don't want
Want
that.
to get vaccinated? Yes. You don't want to get infected.
You don't want to
Number
get
one,
it, period.
the problem is if you do get infected at an adult stage, syempre, you might have your own children,
Mm-hmm.
and then your wife or your husband would get it from you, and then you would pass it down again to your children,
Someone else. Yeah.
proliferating the diseases. So we want to eliminate, if possible, that kind of transmission altogether.
Thank you, doctor. Okay, rabies. Let's talk about that because can you vaccinate again? I mean, rabies vaccinations. Okay, so we vaccinate the dogs so they don't get rabies. Yes, and well, it's hard to vaccinate rats and other animals that carry it, no, because first of all, you don't want them in your home. But
Yes.
there's these vaccinations. Because what usually happens is that when a person gets bitten by an animal, that's when they get the vaccine. Is there such a thing as getting it preemptive to that, so that when you get bitten, you don't get it, or no?
Yes, there is. That's what we call what we call as pre-exposure prophylaxis. No? So we do advise that for patients who are at risk of getting dog bites. So particularly patients who actually handle rabies. I mean medical professionals who actually handle rabies patients
Mhm.
and veterinarians.
Yes.
Yes, and then we want to push it, but remember, because of the cost, we also want to have our pet owners to have it. Remember, there's always the risk that your dog, your cat,
Mhm.
may scratch you, may bite you, and that would require a rabies vaccination.
Mhm.
So
Yeah.
I think I want to make just to clarify it out there. One misconception is that rats actually have rabies.
Oh, so they don't. Bats.
They don't. So what we consider as a rabies-prone animals include your dogs, of course, your cats.
Bats.
The rats are not considered because they're so small. If they do get bitten by a rabid animal, they already die.
Ah, okay, they die. Yeah.
And then there are actually reports here in the Philippines that carabaos and goats have had rabies.
Wow, is that a new thing?
No, it's not a new thing. It's a previous report. But then more of I would actually put it more upper than the list compared to rats, because they're bigger. They can serve if they get bitten by a rabid animal. They would survive longer and then could wreak havoc, as compared to rats that if ever they do get bitten by a rabid animal, they usually die.
Yeah, they die faster and they don't really have much of an opportunity to hang out with you. And
Yes.
yes.
But then the problem with other animal bites. So let's say the rabies are your dogs, cats.
Mhm.
But then with your other animal bites, what we want to protect is your tetanus.
Mhm.
So we don't know where those animals sink their teeth into,
Mhm.
and one of those bacteria that they may carry is your tetanus, your
Mhm.
Clostridium tetani, and that causes the tetanus.
Okay. Tetanus shots were terrifying to me. Well, I guess a lot of shots are terrifying to children.
Yes.
The tetanus shot, um, okay, let's talk about how come, like, it's not just for all the other vaccines you mentioned. Oh, we can actually talk about this a little bit later. But the tetanus, just to ask it, you can find it sometimes if, let's say, you have people who fall down somewhere or get their knees scraped. You're riding on a motorcycle, get your knee scraped. They would recommend a tetanus shot if yours is not updated and if you're, and all of that. So is tetanus found in the soil? Is it found anywhere in the ground, in the dirt? And then when I remember they also like there, I don't know if this is a myth, but tetanus is found in rust. So like if you scratch your thing on a let's say rusty nail or something, then you can get tetanus.
Yeah. To clarify, strictly, the bacteria that causes the tetanus is a soil-borne pathogen.
Mhm.
No, so actually we give example for patients who figured in a motorcycle accident and they get scratched and then they roll over the dirt. That's one of those times that we give the tetanus vaccine. Now, coincidentally, the thing with tetanus and rust is not really because of the rust.
Mhm.
It's because it's exposed into something else, the soil particularly. It's not necessarily the rust. I mean the bacteria does not reside on the rust. It's on the soil that could have been there on the nail.
On
Parang
the
ganun. So
rusty
it's
peel.
more of what we call as tetanus prone wounds are those that are considered dirty. So anything dirty, we
Mhm.
should recommend tetanus shots. One time I had a patient who sliced his hand while chopping vegetables.
Mhm. Yeah.
During that time, I considered it as a very clean cut. It was the knife was not touching any ground, so that can be considered as a not a clean wound.
Yeah.
However, I took the opportunity for that patient to have him vaccinated already for the tetanus, even
Yeah.
though that specific wound was not yet considered a tetanus prone
Mhm.
wound. So what we want to also tell our viewers that are also doctors is whenever you have a chance to vaccinate.
Mhm.
I think that's a very very important lesson here.
Well, yes, because one, they're covered in case, even if it's considered a clean wound, they're covered for any further, dirty wounds.
You can always be sure that it was not, I mean, the vegetables may have had soil in it and all that.
I was going to say the vegetables may have had soil. You don't know if they were able to wash it properly. I mean, these things, maybe we can ingest them, but if it goes in through a cut, then, then the
Yes.
manifest. And I also, I know of someone who had a pedicure and then, the wound and everything and then tetanus and she died. So that was a long time ago, but it was just, shocking. You think it's just a wound in your toe. It's not going away. And then within a few days, like the tetanus manifested, lockjaw. Well, at least that was the diagnosis at the time. I didn't get to involve.
Yeah, you can get those from those kinds of practices. So, syempre, during that time, before COVID, the pedicures were a bit parang they were infamous for causing foot infections and all that.
Yes.
But because of improperly cleaned implements.
Should always be boiled. And,
Yes, should always be sterilized and then removed of the actual debris.
Mm-hmm. Yes. I mean, because of course there are people who would go around and do it and not really clean their instruments in in doing these things, and then it's like from foot to foot ill, but from foot to foot
Yeah.
to foot, and then you never know where it went already. They put it in their bag,
Yes.
it's sterilized, so there you go. So I mean, I'm just bringing that up because that could be scenarios that people do not think of and just take for granted, So actually, okay. So I won't ask you how you treat. Maybe later, I don't know. It might come up how you treat some of these diseases, but we're talking more about the prevention and vaccinating. So, okay, you did mention COVID-19 earlier, so we have to talk about that. The COVID-19 vaccine or vaccines that are out there, they don't actually prevent you from. I mean, they're not foolproof in terms of preventing you from getting COVID, right? But why are they
Yes.
important?
Uh, so I want to put out a concept in vaccination that what we usually measure for vaccines is what we call as efficacy. No? So this efficacy is seen in what we do in controlled situations. The efficacy that they say, 90% efficacy. It just says that patients who are vaccinated are 90% less likely to get the disease compared to those that are not vaccinated. It's not always. It doesn't mean that 90% effectivity, 10% of those vaccinated are gonna get it. No, it's not like that. It's more of it offers you protection compared to those who are not vaccinated. Still, there is still a chance that you get it. Now, what are the reasons why even if you are vaccinated, you still get the COVID vaccine? Number one, the COVID vaccine is a very complex virus. No, it has different strains. No, we've seen it. We've heard all the names in the news and the social media, the B10, everything. We've heard all of it.
Actually.
Yeah. So when you do get a vaccine specific to the variant that you are vaccinated to, the thing is, it only offers partial protection for some of the other variants. But then collectively, if you have multiple shots, that's why we have boosters. You can mount a better response if you do get any variant. So that's what we do. That's why we have your primary series, and then you have your booster vaccinations to help your body mount a better response when it does come to you.
Okay, thank you, doctor. And also, they were saying before that if you get the COVID-19 vaccine, yeah, you can still get it, but the effect or the COVID won't be as strong. Like basically,
Yes.
like, is that correct? Like if you were gonna get it, let's say you had gotten it and you weren't vaccinated, and it would have led you up to a certain point where your organs were failing. Like it presented in a milder
Yes.
way. Is that true?
That's also true. That's one of the actual outcomes that were measured in most of the clinical trials. No, they know for themselves that you can still get the COVID if you are vaccinated. But then what they did in those trials is that they measured whether you will be better off without a vaccination or with vaccination. So in those trials, we note that for those who are vaccinated, they have lesser time in the hospital. So there's parang the admission
Hi. Okay. Sorry, am I out or is the doctor out? Are we? Hello, doctor? Here we go. Okay. The doctor is just the signal has cut out a bit. So what we're gonna do is we're just gonna continue our discussion of this topic, vaccines, how important they are, what diseases they can actually prevent. We were talking about COVID-19 and how getting vaccinated and getting the boosters gave people who contracted COVID a better chance of, we'll get the doctor back in shortly, a better chance of surviving it. And it is true when the doctor just said that when they conducted the studies, you're better off with getting the vaccine rather than simply, well, not simply, but getting actual COVID without being vaccinated, that your chances of having, they found out, he said, that you stay in the hospital for less time, your case is not as, the kind of COVID you have is not as deadly, perhaps. And also, when we did discuss certain illnesses that have diseases that have been around forever, that have been the way it affects people, the way it hits us, it's greatly been reduced because of vaccines and vaccination programs. Now we're just going to go on a short break, and we'll be right back, and we'll have the doctor back with us to explain more. We're talking about vaccinations, preventable diseases through vaccines, and our guest is Dr. Timmons Cruz from the Health Hub in Makati Medical City. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗶𝘁𝗵. Available for outpatient care services, our 𝗂𝗶𝘁𝗵 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝘁𝗵 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗂𝗶𝘁𝗵 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗂𝗶𝘁𝗵. Hi, this is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, folks, we're back. You're back with Healthline with Makati Med. I'm your host, Nicole Jacinto. We have Dr. Cruz with us, Doc Tim, as he likes to be called on the show. Thank you for joining us. Again, Doc Tim, we just have some signal problems as usual, always in the Philippines. But the show is heard everywhere. It's streaming on all different platforms, and we do have viewers and listeners from all over the world. Okay, so we're talking about vaccines and vaccine preventable diseases, and you explained to us very well. Like, you gave us some of the most common, and we even talked about COVID-19 and why it's better to get vaccinated rather than not. Even if you're saying that you're talking about efficacy and the chance that your chances of getting it or not getting it are better once you've had the vaccine, and also the survival rate or how it affects you, how the disease itself will affect you once you've had that vaccine. So can you tell us, doctor, how do vaccines work? Like, overall, like how do they work when you inject something in the body? Oh, okay. Sorry, doctor. I think
when I try to explain it to patients, I usually sorry.
No. Go ahead. You're okay. You're okay. Sorry.
Am I muted?
No.
Hello? Yeah. Sorry. Yeah. Sorry. It's more of what I usually try to explain to patients, that we're trying to tell the body that this is a disease that we want you to protect yourself from. And we're giving you the blueprints, what this disease looks like. No, so that's the aim of the vaccination. We give something that is not harmful to the body, which kind of mimics the characteristics, the orientation, the face of the disease that we want to defend from. So when your body sees that vaccine, it tries to mount a response. And now the thing with the human body is that it remembers. It always remembers.
Yes.
So when the disease itself comes in on you, your body already remembers from the previous encounter with the vaccine, and now it can mount a better response. As the response, almost immediate, you don't even get the disease. That's how vaccines usually work.
Okay, thanks.
So there are different types of vaccines.
Sorry, go ahead. Yeah.
But that's how we usually do it. Now, in the context of what we call as, we have live vaccines and then the inactivated vaccines. But then I just want to touch up on the COVID mRNA vaccines. No, so that's one of the buzzwords that we have right now.
Yes.
In mRNA vaccines, in the live and the inactivated vaccines, we usually give you a part of the disease, the bacteria, which your body can react to. No? Now, with the mRNA vaccines, what is being given to you is a script, an instruction. So when your body gets that instruction, it tries to manufacture that protein, and that protein is the one that your body will react to.
Okay.
So the beauty with mRNA vaccines is that you don't get any of the part of that disease on your body.
I'm glad you mentioned.
Yes.
I mean, because there were a lot of misconceptions at the time, and okay, so
Yes.
when you do it with a live with a live disease, I guess, was that an older way of doing it, or how they first did it? Like they would, I mean, they would, like, get I guess a very small part, because it's your immune system, right? That you'd like to elicit a response from the body's immune system. So you'd inject a very small amount or put in a very small amount, and as you said, the body always remembers. So the immune system will, like, this is an enemy, right? But
Yes.
it's enough of the enemy. It's just enough so that the body knows this is an enemy. Then your body starts making, it remembers what it looks like, what it feels like, and it starts, like, it starts already making itself not invulnerable, but maybe in a way, like it has the soldiers, let's put it that way, to fight whatever disease that is. And what you inject would be called an antigen. Yes, just correct me anytime if I'm wrong. Is that term correct? Like an antigen? No?
The antigen is the antigen is more a part of the actual live vaccine that is being given to you.
Okay.
Yes, the body reacts to the antigen, but then the antigen is on the virus.
It's on the virus.
Or-
Okay. The virus
Yes.
cell. Okay. Now, when it comes to the mRNA, what you said, the beauty of it was because there were a lot of misconceptions at the time, and maybe I mean, if you'd like to discuss it further, you can go ahead, because people are saying, no, you'll change your DNA, or they're injecting DNA in you, but that's not the case, is it? Like what you
That's
explained.
not the case.
Yes.
So the beauty with the mRNA vaccines is that your body will still get to witness what you call as the antigen of the virus that we want to protect ourselves from. But then the production of that the antigen is from within us. So we are given that script that I told you, that it goes into our body, it's read, and then it's produced.
Okay.
And then it's much like someone goes in, and then so this is how the disease looks like. You make a cartographic sketch, and then you post the cartographic sketch all over the place. Parang ganun yung nangyayari. You don't get a part of the disease in there. And then the misconception is that because it's an mRNA is parang a family of the DNA, no? It gets embedded in you. No, so that's one of the misconceptions. It's not embedded in your cells. It's just read one time, and then release the vaccine. And then after that information is read by your cells, it gets destroyed. So it does not get incorporated into your own DNA. That's a very big misconception.
Thank you, doctor, for explaining that. Thank you. I mean, I'm sure you probably still get a lot of questions when it comes to mRNA vaccines. And is mRNA a newer technology? I mean, in general, how long have vaccines been around? If you can just, like, give us an idea, just, a general idea, so we understand that this isn't, a very new thing, and that in the medical field, this is something that people actively work on. Like, they just do.
Yes.
That's what they do. Yeah.
Yeah. The technology to develop the mRNA vaccines have been here with us for decades.
Yes.
And that definitely the COVID-19 vaccines are new, because it was just, it's also a new disease. But then the technology to make those mRNA vaccines have already been with us since the decades. I would say 1980s, 1970s. But then it was only during that time it was parang a revolutionary way to do the vaccines, but yet we weren't able to successfully use it for some of the vaccines, some of the diseases that we have. And that at this time it was only the advent of the COVID was one of the times that we were able to use that decades old technology to suppress that disease. In terms of how long we've been using vaccines, it's been, if I remember correctly, around hundreds of years. The very first vaccine was the smallpox vaccine, which was made in around 1700. The thing is, you talked about earlier that during that time, when a family member has a chicken pox, no, you tell other kids to approach him para magkaroon na kayo pare-pareho.
Yeah.
So, yun yung yun din yung naging unang start ng vaccination din talaga. So, the smallpox was a vaccine, was a disease for adults, no? But then it's much like the chickenpox, but then it could be deadly. Ngayon, the first scientist who discovered vaccination was that they saw that a similar disease was found in your cows. And then what he tried to do, a bit unorthodox, but then he tried to get the blisters of that cow and then injected it onto a different person. And then it seemed that when he injected that cow disease to that other person, he was immune to the smallpox. So that's how it all started. That's a very good example of a live attenuated vaccine. It was a live vaccine, but it was a weaker vaccine, and it was enough for our body to recognize that as a significant threat, that when the smallpox came to our bodies, we were able to mount a good response and destroy the smallpox is actually eradicated in the world. Right?
It's eradicated. So, I mean, there must be a sample somewhere. Oh my God.
Yeah. For studies. I hopefully wala namang lumabas.
Yeah.
But then the DNA, the DNA coding of that smallpox is still available somewhere in the data bank. I hope.
Yes. But then, well, just in case, you could use it to help rather than harm. I mean, yeah. So the smallpox was eradicated, and it's a big step. Like, people were just dying from it. It was something. When was it successfully eradicated? Like was it the 1970s or?
It was already 1796 was the first. The actual vaccine was created, and then soon after it was eradicated within 1800s na po.
Yeah, 1800s. Okay, wow. Okay, so that's great. So, does this speak to how effective vaccines are at preventing diseases?
Yes. So that's the goal of the vaccination. We want to eradicate disease. No, the thing is, it was easier or it was optimal for us to eradicate smallpox vaccine because number one, it was only seen in humans. So if you just vaccinate all the humans, wala na. Parang ganun. So, however, this presents problems with the future diseases that we have now. No, so particularly what we do have are the rabies. The rabies we can also see it in animals.
Yes.
No? Again, you actually get it from animals, from rabid dogs and cats. No, so yes, we can hope to vaccinate all animals, hopefully, or all rabid animals, and then all humans. But then the logistics of that is cumbersome. No, I mean, hopefully, we can do it. But then right now, it's more of we want to prevent the deaths first.
Yes. You want to
targeting eradication. What we do target for eradication is polio.
Polio, okay.
Yes. So we're on our way, hopefully, to eradicating polio. And then other diseases such as measles, mumps, and rubella are also in that plan, elimination. And then hopefully, with the advent of continuous vaccination, even if we don't see any of those diseases at the moment, we can hopefully eradicate those diseases.
Thank you, doctor. And are there factors that contribute to how effective it is in? Well, you just mentioned some, like, of course, rabies is more difficult because you find it in so many animals, the logistics. So what would you do? Capture wild animals, and it's kind of, I mean, every kind of wild or domesticated animal plus human, so that's a bit difficult. But what other factors contribute to a vaccine or against a certain disease or a number of diseases being very effective in stopping the disease from spreading at all, or stopping deaths, or the suffering from once you've acquired the disease.
So other factors that would influence the effectivity of vaccines. There's so many, but it starts from the time the vaccine is manufactured, what type of vaccine, how those vaccines are delivered to places where they have to be given, and then the time that the vaccine was injected in your body. So there are a lot of factors. No, particularly in the context of COVID-19, one of the biggest factor was then the production, number one. And then the delivery of those vaccines to the needed populations. And then, syempre, hopefully, yung cost, it was a very costly procedure to do it and all. And then, we also note here the different populations have different responses to vaccines. No? So, as a additional info lang, when we procured some of our vaccines from the different companies that made them, we tried to get those vaccines wherein in those clinical trials that they've done, they included Filipinos.
Yes.
So
it's different.
It's very different responses from different. There are lots of factors. So we want to get vaccines that were closely, at least may nasamang mga Filipino dun sa mga trials nila. We have at least a better grasp na, this was tried on a Filipino patient, different practices compared to a Caucasian, Chinese, Japanese, all those factors come into play when you do get the vaccine.
Okay, that's amazing. I mean, I'm learning so much. Please come back and talk more about this or any other topic you'd like, Doctor. I mean, I'm learning so much, and I'm sure people out there are learning it too. So it's just that also plays a factor, like genetics, your makeup, I don't know, maybe your culture, however it is. No? So okay, that's just like mind blowing to know that it's not just a one dose for all thing. And then that's why you try to get the companies that, like, there were Filipinos in the trial, so this is probably more effective for our population. Okay, and then we talked about vaccines being applicable at birth already, and you mentioned what they are. And then also, okay, can I ask you this? I have to ask this. What are some of the dangers in getting vaccinated? For example, you're allergic to some of the, that's just a small example, some of the ingredients or whatever it is. I mean, how do you work around that?
That's why we also have different vaccine manufacturers. No, it's good that we have different vaccine. Mahirap pag iisa lang yung vaccine. When we do one of the absolute contraindications to vaccination is if you have had a severe reaction to a previous vaccination of the same kind. No? So that's one of the reasons why, when we do give new vaccinations like COVID, we have, I'm sure you've experienced when you were given the vaccination here at your government facility, you were told to stay there for at least 1 hour.
Yes, at least 1 hour.
During that time, you will be observed and we will be watching out for the severe reactions. And if you do develop any of the reaction, may it be mild or severe, it is recorded and reported back to the manufacturers, first to the local health government, and then to the manufacturers, and then they take note of that. Everything is recorded. I mean, we've seen it at work during the COVID times. And then this feedback that we give, that doctors give, that the patients give, will work so that we can give it better to other patients. More or less like it's an active clinical trial then.
Yes. And then, Doctor, let's say it was a case of allergy, or you got some reaction, and you were medicated for it, whether it was an EpiPen or simply taking antihistamines or whatever it is. That doesn't render the vaccine useless, right? I mean, it doesn't affect the how it is. Is it just dealing with the symptoms at that point?
If you do get a severe reaction, that would require you to give an EpiPen and all. the chances of you getting vaccinated with that same vaccine is very dangerous. I myself won't tell you to get the vaccinated again with that same. But then during that first time that you were given that one vaccination, will that be that's the question, right? Will it be null or void if you are given the other?
Yeah.
I would say yes.
It would be not like whatever you received would be null if you were given antihistamine.
Whatever you receive is that especially if the vaccine that you're being given is a multi-dose vaccine.
Okay.
You have 3 doses. Syempre, to get the full effect of the vaccine, the full effect of the vaccine increases with more doses given. So if you're just given one and then you already reacted to that, the chances of mounting a sufficient response to that disease is severely diminished.
Okay. Thank you, doctor. But I mean, not to worry if your reaction wasn't so bad. Let's say there were oral
Rashes.
histamines and it was controlled and you did get the second dose, you're still pretty much
But it's still okay.
Yeah.
So the ones that we are after are the severe reactions, severe difficulty breathing, flushing all over, and then you have to be rushed to the hospital. Definitely, we won't be able to give you the next vaccines. But with mild reactions like rash, fever, itchiness, a bit of itchiness, we can consider that as mild, and then we'll just monitor you closely.
Sometimes it's also anxiety. You just need to be okay.
Sometimes it is. Sometimes it is.
Yes. Okay. Doctor, do you want to clear up any misconceptions about vaccines? I'm told we're running out of time. Any misconceptions, or is there anything you'd like to, like when it comes up, how do you explain it to patients? You've done it really well here today, so I can see how you explain it to patients. Any misconceptions or anything else you'd like to add about vaccines, vaccination, any advocacy that you have to help people from not getting sick and being vaccinated properly? Any misconceptions?
I just want to say that a big misconception that I want to put out there is that not just because you have been vaccinated, you are 100% completely rid of the disease. No, doesn't stop. It shouldn't stop you from still wearing your masks. You doing your hand hygiene and distancing yourselves from other people when you are sick. I mean, it's just right now. It's just etiquette for us. We have to do that. If you're already sick, say it. Tell it to your work so that you won't have to come, and then still wear your mask whenever you have your respiratory symptoms.
Doc, I'm sorry to interrupt. I forgot. This is very important. There's a pertussis outbreak. So that's a whooping cough. Just if you can talk about that really fast,
really fast. Pertussis is a disease of the children. Whooping cough, cough, and then that's why they call it the whooping cough. There's a parang sinok because of the sunod cough, and then it could be problematic with the children. Now, there has been a lapse of vaccination. According to DOH, there's been a lapse of vaccination of the DPT because of the COVID pandemic. Children were not brought to the health centers as they were before. And now, because there are patients who are unvaccinated, there's higher chances that it circulates. So that's why we have that. Now, being the pertussis vaccine is actually recommended for all children. And secondly, you have your pregnant patients.
And
then thirdly, your immunocompromised patients, your elderly, those with HIV, on cancer treatment or steroids. So that's how I would finish up with that pertussis. So get vaccinated if you are one of those special populations, and if you have the time and financial capability to do it, get vaccinated with the Tdap.
There was an outbreak in the UK of the whooping cough before it came here, so it's a thing. Maybe people just didn't get vaccinated for that in particular. There was an outbreak and adults got it as well. So it's not just us. Maybe
it's not just us. So according to the DOH, it was attributed to the lack of decrease in the vaccination rates during the pandemic. Number one, because we were not bringing out our children left and right during that time. I mean, we were very, very careful because of the other diseases.
Yes, the other diseases that were deadlier at the time. Okay, doctor, thank you for being on the show. Is there anyone you'd like to say hello to or anything else you'd like to say? You have the floor.
For this, I would just like to greet everyone, and siguro final words is that whenever you feel sick, number one, continue to mask up, continue to wash your hands frequently, and then distance yourself from other people. And that's the added layer that you can do is to get vaccinated for all the diseases that you can, especially those that are at risk for you.
Thank you, doctor. Thank you so much for being on the program. It's been very educational and enlightening for me, and I'm sure it will be for our other viewers and listeners as well. Please do come back anytime to talk about, can tell you're passionate about vaccines, and not just that, you're very knowledgeable. I'm sure there are so many other things you know as an internist, and we could discuss any of those topics. Health is always relevant. So thank you so much for being on the show today. And I do invite you to please come back soon. Let's talk.
Thank you for having me, and I would be very happy to come back.
I love listening to you. I mean, I do. I learned so much. Thank you so much, doctor. This is the kind of show that makes me happy. Thank you. All right, everybody. So we'll see you next week on Healthline with Makati Med. That was Dr. 𝗵𝗠𝗁𝗁 from the Health Hub of Makati Medical Center. And we'll be back next week with another topic. Maybe another doctor, or maybe he'll come back. You've met some of the doctors several times, and we'd like to see Dr. Tim or Doc Tim come back again. Thank you, everybody. Thanks for tuning into the show next week, Monday, 5 to 6. Bye.
The views and comments of the hosts and guests are not necessarily